Director of Communications and Hispanic Outreach at Child Trends. On behalf of the National Research Center on Hispanic Children and Families, or in short, the Hispanic Research Center, welcome to this webinar. The Hispanic Research Center, as you will hear in more detail in a few minutes, was launched in 2013 and is designed to provide research and capacity building activities to help programs and policy better serve low-income Hispanic children and families across the country. Today, we will be sharing with you the findings from two of our current research efforts that provide information on the context in which Latino children are growing up. First, we will focus on Hispanic families, how they're formed and structured. Then we will focus on Hispanic households, adult employment, the number of people living in households, among other factors that contribute to the environment. Interestingly, we have found some notable advantages to Latino children with at least one immigrant parent as compared to those with only U.S.-born parents. It is our goal that these new research efforts help inform policy and practice. Throughout the webinar, if you have any technical questions, please submit them online. You will see a box on the right-hand side of your screen where you can easily submit questions to our team. They will get back to you. This is also the same place where you can submit questions to our panelists at any time during the presentation. We will queue them up and present them to the speakers during our Q&A. We estimate that we're going to have about 10 minutes for Q&A. It's important to note that we are live tweeting the presentation with the hashtag Hispanic Families. Please join the conversation. So now I'd like to introduce the speakers for today's webinar. You will hear from 5 panelists. Ann Rivera will provide introductory remarks. Dr. Rivera is from the Office of Planning, Research, and Evaluation within the Administration for Children and Families of the United States Department of Health and Human Services. She oversees research grants and contracts focused primarily on early care and education and child care programs aimed at improving human services for Hispanics. She is the Federal Project Officer for the Hispanic Research Center. Then you will hear from the 2 co-directors of the Hispanic Research Center who will introduce the center and provide an overview of the research findings featured today. First to speak will be Michael Lopez. Dr. Lopez is a Principal Associate at Apt Associates and a national expert for over 20 years of experience, conducting applied early childhood research with an emphasis on low-income, culturally and linguistically diverse populations. Then you will hear from the other co-director of the center, Lida Guzman. Dr. Guzman is a senior researcher at Child Trends, where she oversees the Child Trends Hispanic Institute. Her substantive research focuses on reproductive health and union formation among minority teens and young adults, in particular Latinos. Finally, you will hear from 2 discussants who will address the relevance of this research to their specific areas of expertise. First, Rick Noriega will provide a practitioner's perspective. Mr. Noriega is President and CEO of Avance, a national 2-generation nonprofit organization dedicated to parental involvement in child development. Hispanic Business Magazine named Mr. Noriega one of the top 100 influential Hispanics in the United States and recognized Avance in their top 25 nonprofit lists for 7 years running. Finally, you will hear from Sharice Johnson, who will provide a policy perspective. Ms. Johnson is the branch chief for the Healthy Marriage and Responsible Fatherhood Discretionary Grant Program in the Office of Family Assistance at the Administration for Children and Families at HHS. Ms. Johnson is a senior manager with experience administering programs that support positive child and family outcomes. Before proceeding, I'd like to just point out that the views expressed in the presentation express the views of the center and not necessarily the views of the federal government. With that, I will turn it over to Ann Rivera for her introductory remarks. Ann?
Thank you, Alicia. Good afternoon. Buenas tardes, everyone. The National Research Center on Hispanic Children and Families was established in 2013, as Alicia mentioned, by the Administration for Children and Families through a 5-year cooperative agreement to Child Trends in partnership with Apt Associates and academic partners. As you may know, The Administration for Children and Families is a division of the Department of Health and Human Services and administers several federal programs designed to promote the economic and social well-being of families, children, individuals, and communities. ACF's programs include temporary assistance for needy families, Head Start, child care subsidies, healthy marriage and responsible fatherhood, community services block grants, services for unaccompanied children for the prevention of child abuse and neglect, and many other programs that aim to strengthen low-income families and individuals and to address the needs of vulnerable populations in the United States. Hispanics constitute nearly a third of the nation's poor. By some measures of need, Hispanics have the highest poverty rate of any racial or ethnic group in the U.S. More Hispanic children are living in poverty than children of any other racial or ethnic group. 1 in 4 children in the U.S. is Hispanic, yet 35% of all poor children in the U.S. are Hispanic. Within ACF programs, participation by Hispanic families varies dramatically. Approximately 31% of families receiving TANF identify as Hispanic. In the early childhood area, while 38% of children enrolled in Head Start programs are Hispanic, only about 22% of the families receiving monthly child care assistance are Hispanic. ACF is continuously seeking to strengthen its policies and programming to meet the service needs of low-income and vulnerable populations, and there are clearly unmet needs among Hispanic families. To this end, over the years, ACF has funded several research efforts to examine the service needs and experiences of Hispanic children and families. These projects have often focused on specific program areas such as the promotion of healthy marriage, poverty and inequality, Head Start programs. However, we've long recognized that many of the questions examined and the issues emerging are similar, although the implications may differ by program. Recognizing the interrelated nature of the program's challenges in serving Hispanic families and many common questions, ACF established a research center to advance understanding about low-income Hispanic families with new research, to build capacity in the field to conduct high-quality research on issues of relevance to ACF concerning Hispanic populations, and to promote use of the center's research, especially to inform ACF programs and policies. I hope that you gain new insights, as I have, from today's discussion that will support the work that you do. Now I turn to Lina Guzman to share the work of the center with you.
Actually, now we're going to be turning it over to Mike, who's going to give a brief overview of the center, and then I will be talking about some of the research that the center has done over the last year or so. Mike?
Thank you, Lina and Ann. And again, bienvenidos to those joining us from across the country. So why do we need a research center on Hispanic children and families? The answer, we believe, lies in 4 demographic facts. As Ann just mentioned, today, roughly 1 in 4 of all children, that's 1 in 4, and 17% of the general population in the U.S. is Hispanic. Hispanics represent the largest and one of the fastest growing racial ethnic minority groups in the U.S. Thus, given these demographic trends, how Hispanics fare will have profound implications for the future well-being of our country. Second, economic security is precarious for many Hispanic children. Roughly 1/3 Latino children live in poverty, and 2/3 live in low-income families, defined as those with incomes less than twice the poverty line. In other words, the majority of Hispanic children are part of the target population served by many of the publicly funded programs and policies. Third, the vast majority of Hispanic children are U.S. born. In fact, recent increases in the Latino population are being driven not by immigration, but by births. Finally, although the vast majority of Latino children are U.S. born, the immigrant experience is a reality for many. Roughly half have at least one parent who was born outside of the U.S., and roughly 3/4 speak a language other than English at home. As we think about our programs and policies and how to best support Latino children and families, it is important to consider these family experiences, including their exposure to languages other than English and growing up in poverty, as well as the considerable diversity that exists within the Latino population. This is particularly important because data suggests that Hispanics have lower rates of participation in many government programs and services, despite their relatively high levels of poverty. With this in mind, ACF has invested substantial funds to launch a National Research Center on Hispanic Children and Families. The overarching goal of the Hispanic Research Center is to conduct new research and provide research-based information to inform ACF programs and policies supporting Hispanic children and families around the center's 3 priority areas: healthy marriage and responsible fatherhood, poverty and self-sufficiency, and early care and education. Our work is guided by one important question: what, at the end of the day, should programs and policies be doing differently, if anything, to better serve Hispanic children and families? Because the goal of the Hispanic Research Center is to help inform programs and policies, our target population is primarily focused on low-income Latinos. To further guide our work, the Hispanic Research Center has 3 objectives. The first is to advance a cutting-edge research agenda across the 3 priority areas. The second objective is to build an extensive network of partners and collaborators, develop a knowledge base along with new tools and resources, and also to support emerging scholars in the field. The third objective is to implement an innovative communication and dissemination approach. It is critical to our mission that the work of the center actually gets in the hands of the key stakeholders, such as many of you all on the phone. And now I'll turn it over to Lena Guzman, who will present on research that we recently published on the family structure and family formation and household complexity among low-income Hispanics. Lena.
Thanks, Mike. And again, thank you to all of you for taking the time today to hear about the work of the Hispanic Research Center. As I said a moment ago, over the last year, we've been busy building the knowledge base on the characteristics and experiences of low-income Hispanic children and families. And today I'll share with you the findings of 2 of our current research efforts, which were just recently published. The first examines the relationship and childbearing patterns among low-income Hispanic men and women, and the second examines the household characteristics of low-income Hispanic children. So first, let's talk about why we should consider families and households and what the difference is. As you may know, families across all industrialized countries have been experiencing rapid and important changes. Marriage is declining, while cohabitation and non-marital childbearing is increasing. These changes have not impacted all racial and ethnic groups the same. And how these changes have impacted Hispanics in particular is less well understood than it is for some other groups. So what do I mean by families and households? Families, generally speaking, refer to those who are related by blood, marriage, or adoption, whereas households refer to those who occupy a housing unit, that is, those who live under the same roof. The 2 often overlap, but not always. Research also tells us that both families and households are critically important to adult and child well-being as they shape resources and impact program eligibility. Understanding the interplay between Hispanic families and households can offer critical knowledge to stakeholders on how to better reach and support this population. So the research that I'm about to present examines the natures of families and households from 2 perspectives. That is the adult and that of the child. First, we take the lens of adults and describe how low-income families are formed. Specifically, we use data from the National Survey of Family Growth, which is a nationally representative survey of adults of childbearing age, to describe the relationship and childbearing histories of low-income Hispanic men and women. The NSFG provides a nice sample size of both Hispanics, Blacks, and whites. Next, we take the lens of the child and describe low-income Hispanic child households. We use data from the American Community Survey to describe household characteristics such as family structure, household size, crowdedness, and adult employment. Importantly, both data sets allow us to distinguish by nativity status, that is, whether someone was born within or outside of the U.S. We do this because past research indicates that the experiences of Hispanics vary greatly by nativity, and that these differences are obscured when Hispanics are examined as a whole. Additionally, as Mike pointed out earlier, just under half of, or just under half of all Hispanic adults are foreign-born. In order to see how Hispanics are faring relative to other groups, we also look for differences between low-income Hispanics and low-income blacks and whites. So first, what do we find when we look at the family formation patterns of low-income Hispanic adults? Briefly, we find that low-income Hispanic women begin families early, they marry quite young, and have children early. Hispanic men, on the other hand, tend to form families somewhat later than Hispanic women, with one important exception that you'll see in a moment. We also see that childbearing often takes place within the context of a two-parent family, whether that's within a marriage or a cohabiting union. And we see that nativity matters. We see important and large divergences in the family formation patterns between foreign and U.S.-born low-income Hispanic men and women. And this difference is particularly pronounced among men. So in this graph, we depict the marriage patterns of low-income Hispanics and how they compare to low-income white and black peers. As a note, Hispanics are depicted in the tan and orange colors, with women in the darker shade and men in the paler shade. Whites are depicted in purple and blacks in teal. This is a color scheme that we'll be using throughout the presentation, so keep it in mind because there'll be a quiz at the end. As you can see in this figure, we find that low-income foreign-born Hispanics are more likely to be currently married than any other group, and this is true for both men and for women. Looking at the set of columns on the left-hand side, we see that 36% of foreign-born Hispanic women and 35% of foreign-born Hispanic men are currently married. In contrast, low-income U.S.-born Hispanics in the second set of columns more closely resemble low-income whites, with just around a quarter of U.S.-born low-income Hispanics currently married. Thus, despite historic declines in marriage over the last several decades, levels of marriage among foreign-born Hispanics remains relatively high. In these next two slides, we'll look more closely at the context of childbearing. And here we show the percentage of low-income women and men, the men will be shown in a minute, who've had a teen birth or birth before the age of 20. And this measure is particularly important as early childbearing is associated with poor social, economic, and developmental outcomes for children, as well as their parents across all racial and ethnic groups. As you can see in this figure, early childbearing is quite common among all low-income women. Looking specifically at low-income Hispanic women, shown in the dark tan and orange colors on the left-hand side of the figure, we see that approximately half have had a first birth by the age of 20, irrespective of their nativity status. And this level falls somewhere in between the levels that we see for low-income white and black women. And now, interestingly, when we bring in men, we see that early births are much less common among low-income Hispanic men than they are among women. However, in contrast to the patterns among women, we see large nativity differences. As you can see here, 30% of low-income U.S.-born Hispanic men, shown in the light orange, have fathered a child by the age of 20. These levels are comparable to those that we see among low-income black men. However, only 14% of foreign-born Hispanic men, shown in the light tan, have fathered a child by the age of 20. So again, we see big nativity differences when it comes to the early childbearing patterns of low-income Hispanic men. The findings on this slide bring together the findings of the previous slides. Specifically, we find that most births to low-income Hispanic men and women occur within a two-parent family, particularly for the foreign-born. Again, looking at the set of columns on the left-hand side, we see that 79% of foreign-born Hispanic women and 88% of foreign-born Hispanic men were in some sort of co-residential union at the time of the birth of their first child. These rates are higher than that of the other groups. Among the native-born Hispanics, on the other hand, we see lower percentages of births within a two-parent union, especially when compared to the foreign-born Hispanics, but the levels of births within two-parent unions among the native-born Hispanics is higher than we see among low-income Blacks. This finding is important because we know that while children thrive in many different family environments, research tells us that in general, children fare better in stable, low-conflict two-parent families. Now let's turn to the households in which Hispanic children live. We find that Hispanic child households have characteristics that offer many advantages, but also present some challenges. Again, however, as you'll see over the next few slides, these differ quite a bit by the nativity status of the child's parent. Among those with foreign-born parents, we see greater levels of married two-parent households, resident father households, and adult employment relative to peers. We also see a high incidence of crowded housing, which can signal both need but can also offer advantages. Among those with U.S.-born parents, we see levels of single-parent and non-resident father households that are approaching those seen among their low-income Black peers. However, adult employment remains relatively high. So here we consider the presence of fathers in households. And again, as I mentioned a moment ago, we see divergence in the experiences of low-income Hispanic children by their parents' nativity status. We find that half of low-income Hispanic children with a foreign-born parent live with their biological fathers, as seen in the tan bar on the left-hand side. This is much higher than their counterparts with U.S.-born parents, as well as higher than what we see among low-income white and Black children. Also on the positive side, we find that the majority of low-income Hispanic children live with an employed adult. The vast majority of low-income Hispanic children with a foreign-born parent, 81%, live with an employed adult, as do roughly 2/3 of those with U.S.-born parents. This is similar to that which we see among whites, but higher than that we see among their Black peers. Again, this is good news because adult employment is likely to be associated with greater economic resources and stability for children. And last, we take a look at crowdedness of Hispanic child households. As you can see in this figure, low-income Hispanic children, particularly those with foreign-born parents, live in crowded conditions. And we define crowded conditions as having 3 or more people per bedroom. Low-income Hispanic children with a foreign-born parent are roughly twice as likely to live in crowded housing as their counterparts with U.S.-born parents, and roughly 4 times as likely as their white and Black peers. So to recap, we see that when we look at the family formation patterns of low-income Hispanic men and women, we see that low-income Hispanic family formation patterns differ in many important ways from that of their white and Black counterparts. Low-income Hispanic women, for example, start families quite early, and they have children quite early. In contrast, low-income Hispanic men tend to start families somewhat later. We also see that nativity matters. Notably, we see higher rates of marriage and more births occurring within two-parent families, especially among the foreign-born. We also see relatively high levels of teen fatherhood among U.S.-born Hispanic men. Regardless of these differences, however, the vast majority of low-income Hispanic men and women have children in married or cohabiting families. In terms of the household characteristics of children, again, we see that nativity matters. The picture that appears depends in large part by the nativity status of their parents. Generally, we find that Hispanic households have characteristics that offer advantages, but also present some challenges. And these advantages appear to be particularly pronounced for those with foreign-born parents. Nonetheless, irrespective of their parents' nativity status, we see relatively high levels of adult employment. So, what does this mean for research? What is the implications of this research for policies and programs? First and foremost, that Hispanics make up 1 in 4 of all children makes it incumbent upon all of us to better understand their characteristics and experiences. Our work and that of others clearly indicates that their experiences differ in critical ways from that of other low-income and racial ethnic groups, and that this diversity, and that there is tremendous diversity within the Hispanic population. We examine diversity by looking at nativity status, but nativity status is likely the tip of the iceberg. Other important characteristics to consider include country of origin or region of the country, for example. That most low-income Hispanic children are born into two-parent families and have fathers present also has important implications. The birth of a child, for example, may be a critical time to provide services and programs to support and strengthen young families. Outreach and engagement to fathers may also be particularly important. Our findings also suggest that we should be paying attention to the family formation patterns of men. Typically when we think about childbearing, we think about women, but the work that we presented suggests that we need to be also focusing on men, in particular the native-born. The relatively high levels of early childbearing among native-born Hispanic men is particularly worrying and suggests that this is a possible place for programs to continue to focus on. The relatively high levels of engagement in the labor market may also require some further examination of how well programs align with families' work schedules, for example. And more generally, we need to be thinking about what does this higher level of employment mean for adult and child well-being? Does it offer mostly advantages, or does it come at a cost, especially if parents are concentrated in service or manufacturing or construction service sectors, which are much more likely to have non-standard hours or varying schedules, which can often interrupt family routines and schedules. And now I'd like to turn it over to Rick, who's going to be offering his thoughts on what our research means for programs such as Avance who are serving Hispanics. Rick?
Thank you, Lena, and thank everyone who's on this call. I'd like to thank Child Trend and their work, especially on this research project. To have a center like this is certainly long overdue. So, on behalf of our staff, our families we serve, our board, thank you for including Avance on this panel discussion. So, just briefly, for those who may not be aware of Avance, for 40 years we have been administering our signature parent-child education program, which is a two-generation program where we teach that the parent is the first teacher and the home is the first classroom. We've been administering this to predominantly Hispanic families, primarily in Texas, but now in southern New Mexico, California, Michigan, and a few other places through partners. Focusing on children that are 0 to 3 with a 27-lesson program on parenting and parent engagement, focusing on the 4 developmental areas of the cognitive, physical, emotional, and social development of the child, while the child is co-located where they are worked with in an age-appropriate setting and learning through play. So the significance of this report to a program like ours in the field, and what I've been asked to talk about briefly, is the so what. So what with this research and this particular findings. And so what I would say first is that we receive lots of reports and lots of studies oftentimes in the field. And I can say that these two particular studies, more than anything else, are very direct and to the point, and it's not a lot of, what I would like to say is not a lot of fluff, but it's very direct in its findings and that is helpful to us. So there are some things that the report does for a program like Avance that it allows us to understand better what the things we need to sustain programmatically and what things we may want to look at to change based on some of the findings and how we can get better in the field. And this is important because for organizations like ourselves, and with the growing conversation about high-quality programs, evidence-based, fidelity, etc., it's critical that we can have this kind of background information to demonstrate to donors or public providers, as a public provider, that we, in essence, are in sync and are addressing the needs of the community. That is critically important to us. And so just a few things I would like to share with you that we see as things as a program that from these findings that we need to sustain and that are helpful. One that's critical is our program. We want to ensure that non-exclusivity, meaning that there are programs out there that for Latino families that either deal with teen fathers or teen mothers or adjudicated parents, or only the firstborn child and parent can be admitted into certain programs, and there are all these different tiers and categories. Though they may be valuable in many instances into specific communities, we have approached our community in a very non-exclusive way, so far as that, the parent arrives, mother or father, with a child in the ages of 0 to 3. And that's important because, as was mentioned in the research, oftentimes we see these households with multiple adult members. And what we have seen through self-reporting is that the adult that returns into these households with a variety of adults in the household, it becomes a pebble in a pond effect where those teachings are brought home to the father, or they're brought home to the abuelita or tia, whoever lives in the house, so that those teachings are replicated in the household. It may be the older brother's time to read to the child, or it may be in terms of health or meals, whatever the case might be, that is extremely important for influence in the family. The other piece that was very that we need to sustain, that was important through the findings, is the adaptability aspect of the communities in which we serve. It was mentioned about the differences between native-born and non-native-born Latino families, and we definitely see large differences in these communities. So, with the non-native-born families, our families are typically in a school-based setting, and so we see a different motivational characteristic of those families versus those that are native-born. And many times, second and third generation Latino families that we deal with in the low-income bracket sometimes have some adjudication issues that come with that family. In the non-native-born families, the motivational difference is, based on being able to sustain the family, and so there's frequently a cash-based kind of a head of household there. If it rains, the spouse typically may not come to the program because the husband is maybe a construction worker and therefore doesn't go to work, so the wife stays home, and we won't see that particular spouse in our program that day. These are the things we see in the field as it applies to our families and learning about them. And so what this particular study, the so what about the things that we need to look at changing programmatically that is helpful, is that more emphasis for us in a train the trainer, if you will, in involving more members of the household into the lessons and the things that we put forth. We typically have families participate in our annual graduations, which is a large festive event. But for us, programmatically, to look at how we better engage other members of the household to influence and make that a learning family and a community environment is something that this study certainly reinforces. And again, the findings of this study certainly help us more than anything substantiate and or look at things to change with the funding base to be able to continue to serve more families and children and build capacity. And I'll stop there.
Thank you, Rick. And now we'll hear from Cherise, who's going to be providing some remarks from her perspective from the Office of Family Assistance. Cherise?
Good afternoon, everyone. Again, I'm Sharice Johnson. I'm the Section Chief for the Healthy Marriage and Responsible Fatherhood Discretionary Grant Program. I really wanted to go through a few slides to really tell you more about TANF, as TANF is the primary funder for the Healthy Marriage and Responsible Fatherhood Program, and to talk more about how it really aligns with the work and supports the efforts that we're trying to improve conditions for families. As you can see on the first slide, the four main purposes of TANF are to assist needy families, reduce the dependency of needy families by promoting job preparation, work and marriage, prevent out-of-wedlock pregnancies, and encouraging the formation and maintenance of two-parent families. And I think the main goal for TANF is really to use what the research tells us to guide some of our thinking. When we think about the Healthy Marriage Responsible Fatherhood program, I just want you to know that $75 million goes to healthy marriage, $75 million goes to responsible fatherhood, with the goal of engaging local communities in really strong program designs that can support families to get to those four TANF purposes, and also to ensure that fathers and relationships and couples are really, really engaged in working together to improve outcomes for their children and their families. You will also see that we have 121 grantees in 47 states. So there definitely are opportunities to make sure that we're engaging even more Hispanic families, because we're really covering a lot of territory in regards to our efforts with the discretionary grant program. In the next slide, you will see what the purpose and goals are for healthy marriage. And you can see is to provide comprehensive healthy relationship and marriage education services and support. And we always have a focus of how can we enhance, improve, stabilize children and families so that we can get the best outcomes for our children as well as our families. And in this, in the legislation for healthy marriage, there was a strong emphasis on promoting healthy marriage and sustaining relationships. Sometimes we take it for granted that families are equipped and have access to support systems that can help them deal with conflict resolution, around family literacy, around financial literacy and planning. And so these programs are really well positioned and designed in communities in order to address these issues. And what we found is that in many cases, low-income families have not traditionally had access to these resources. So through these programs, we're able to support that. In the last cohort of grantees that started in 2011, there was an increased focus on job and career advancement. And you will see at the end of my presentation or my discussion points that we talk more about how can we use job and career advancement to support our Hispanic families. You see that in the next slide that we really serve quite a few Hispanic families, and we serve them in the Healthy Marriage Program. You see the age group ranging for all of the participants that we serve, from young adults into older adults. And you see that employment is a big issue when families come into the program with different levels of employment experience and different levels of educational experience and attainment. If you go to the next slide, you'll see more information around the Responsible Fatherhood program goals. And that's to help fathers improve their relationship with their children. And what was interesting to me about the research is that we find, the research that was shared, that we find that in Hispanic households, you may see more representation of fathers involved and engaged in the lives of their children. And we look at that as definitely an asset because in some situations, in some of our communities, we find that fathers are not engaged and involved in the lives of their children. We also know that when fathers are able to provide for their children and families, you can see that that definitely contributes to the financial well-being of the children and of the family and of stability issues. And with the Responsible Fatherhood program, it's really about ensuring that fathers are engaged throughout the life of the child and that we create opportunities for that. Another piece of the Father Involvement Program mentioned here speaks to fathers that were formerly incarcerated. We have a group of grantees who only serve fathers who've had incarceration situations, and we try to make sure that that father can reconnect with that family and be involved in the life of the child upon release, and also while incarcerated. As you look at the file, the next slide, you will see that, again, in the Responsible Fatherhood program, we have a large representation of Hispanic families, and similar in regards to age as healthy marriage, and also in educational attainment and employment issues. One thing to note on this file is that in this slide, that we do have a large percentage of the fathers who are unemployed that enter the program. Unlike what I think I heard and read in the research, where you see more Hispanic fathers are employed, or at least there's one adult employed in most of the Hispanic families, which is definitely a strength. When we go to the next slide, you know, after listening to all of the comments this afternoon, after reading the report, it brings about quite a few questions. And the first question it brings about for us in OFA is grantees. How do we really ensure that our grantees are meeting the service needs of low-income families? You know, and one perspective is the access. You know, I mentioned earlier that we're in 47 states, but in those 47 states, you know, what are our recruitment and outreach efforts to make sure that we're tapping into communities that need our services the most? So really paying attention to that in regards to low-income Hispanic families will be key. And recognizing also that identifying partners in the community to help our grantees to identify low-income Hispanic families will be key. And next, really understanding the family structure. I think sometimes we make assumptions about that all families look alike, or that families experience the same things. But some of the things that were described in the report really talked about some things to consider when serving low-income Hispanic families around the family structure, how many individuals may be a part of one household, the crowding issues and the challenges that they present. And then in a positive note, when the family structure includes a father, how to really reach out to the father and let the father know that services are available to them. And we find that not only with Hispanic families, but sometimes in some of our healthy marriage programs, we are not reaching out to fathers because we think they're absent, but what are ways to reach out to fathers? And then just really understanding more about how we look at foreign-born versus U.S.-born. You know, I would guess that we may not have always considered that in some of the different factors that play into resident fathers that were foreign-born, or fathers who were U.S.-born, and how that may change the composition of the family, how the father may actually be involved with the family, and really considering some of those things, as well as any beliefs and practices. But one thing that I think the grantees always do, they try to learn from the family. They try to understand the family dynamics by the family teaching them what's going on, and then taking that information to provide the best services for the families. In employment, employed individuals, it was very interesting to me in the research that we find that our Hispanic families have at least one employed adult in the family. And so sometimes it may not be the issue around getting employment as much as it is establishing career pathways and to increase wages to support employment and support family stability. So, you know, that's a question that actually kind of is relevant to us looking at our job readiness training, you know, language barriers, what would prevent people from getting certifications or participating in getting hired to, you know, trades and skills to support, you know, wages that are more livable wages and wages that will ensure stability for the family. So thinking about some of those things. One piece that I didn't mention earlier is around the fact that our Healthy Marriage Program targets high school students. And we actually go into high schools across the country and provide relationship education, skills that focus on decision-making, making choices, conflict resolution, and things about just growing up and making a decision as a young person. So when you think about the First Child by 20, you know, I wonder would there be any opportunities really within our high school programs in order to talk about, you know, making decisions that may delay early births, making decisions about relationships, and also making insurance decisions around career goals and pathways that we can touch quite a few of our Hispanic youth in the public school system. And next slide is understanding family structure and formation implication for grantees. We have a wonderful opportunity to talk with our grantees. We bring them together at least annually to talk about their program design. And if they're interested in applying for future funding, this would be a great opportunity to use this information to think about how they design their programs in the future. Understand the characteristics, understand the communities, understand two-parent families, really using a two-gen approach and working with low-income families. Curriculum or curriculum selection, you know, what curriculum have you selected and why did you select it and why do you believe that it really meets the cultural needs of the family and is developmentally appropriate for the population that you've targeted are some things to consider. Staff training and staff recruitment, identifying staff that represent the population that you serve can be some of the things that you consider, or planning for the population that you plan to serve by recruiting Hispanic professionals to support the work, and identifying Hispanic facilitators for some of the training. I'm sure that even with Avance, Rick mentioned a few minutes ago that they're very sensitive to making sure that the staff reflect the population that's being served. And then ongoing staff training, like the information that's provided in these briefs. How do we use that information to support grantees on an ongoing basis by telling them this is what the research is telling us, and using that information to guide decision making and how they design their programs. And then, as I mentioned earlier, recruitment and outreach. How do we really target the population that we want to serve through partnerships and through identifying community groups that we can align our services with to make sure that we're not missing Hispanic communities that we may not traditionally be familiar with. And then finally, in moving forward, we really want to use this information to guide future thinking around, grants, our discretionary grant program. And so, we really need to come up with a dissemination plan. How do we disseminate these briefs within the Healthy Marriage and Responsible Fatherhood grantee community? Would it be an opportunity to do a webinar or something of that type in order to really share information in regards to the research and what it tells us and how we can use it to plan and be more culturally responsive to services to low-income families? And then monitor and highlight best practices. Sometimes we don't always, share the stories that we hear of best practices that have engaged, that we're engaging in, to share across the field and from peer-to-peer with grantees to see this is what worked in my program, or this is something we considered in our program in regards to best practices when serving low-income Hispanic families. And then to post and identify stories in which we talk about some of the successes that we made and how the research informed that. So, there's a lot to be learned, and I really appreciate the fact that this study was done, and I think that it really will add value to our thinking as we move forward in serving families. Thank you.
Thank you so much, Cherise. Well, we've been getting quite a few questions coming in. I'd like to begin with one that I believe that probably Lena and Mike could address. Why do we see some advantages to families with at least one foreign-born parent, in your opinion?
I think that it's related to a number of different factors. And one thing that and this is a question that we often get, and one thing that I like to mention at the beginning is that we need to remember that these findings are based on low-income Hispanics. And I want to just reiterate that that means that this is not suggesting that native-born Hispanics are not experiencing mobility across generations. In fact, we do see a fair amount of mobility across generations in terms of income and education and so forth. So this is when we look at the low income, what do we see? And we see that the foreign-born seem to have certain advantages compared with native-born Latinos. And I think that, there's a number of reasons. One of them is that I do think that we're looking at some degree of self-selection. So that means that those who immigrate to the U.S. are probably looking very different than those who do not immigrate. Immigrants, we know, are more likely to have the entrepreneurial spirit, be those go-getters. They tend to be a little bit more highly educated than those who don't immigrate, compared with those folks from their originating countries. Also, it's also possible on the other end that the native-born who have not made it outside, who have not sort of made it out of the low-income mobility may also be self-selecting in. So they may be sort of coming from much more disadvantaged families and backgrounds than low-income Hispanics who have experienced mobility over the generations. And it may also be that we're seeing differences in terms of what folks have in terms of goals and standards. So for example, we know from research that most adults value marriage very highly, and they value families very highly. But they also want to make sure that they have economic stability and security before they get married. But what you need to get to in order to have that economic stability and security may be a different standard for low-income foreign-born Hispanics who may be in comparing themselves to individuals from their country of origin. So that may be why we're seeing higher levels of marriage, for example. Mike, do you want to add anything to that?
Gotcha.
Yeah, great. Okay, we have had a few questions come in just to kind of clarify. So I want to bundle a couple of those together. How do we define low income? And another one is how are same-sex couples accounted for in these data? So I think that those are two kind of, just to explain that for the audience.
Sure. So low income, by low income, we, for the work that we presented here, we basically took the income spectrum and divided it into quintiles, and we look at the bottom quintile, which roughly represents about under $20,000 or under $20,000 per year, I think in 2012 dollars. So just roughly speaking, about folks making around $20,000.
Great. Okay, and then the other one about the same-sex couples, are they accounted for in these data?
So these are representative of, these are nationally representative, and I'm certain that there are some same-sex couples in here, but this is not something that we specifically looked at, in part because the number of cases that we would have for same-sex couples simply would not be there.
Okay. So moving on, there was a question, Cherise, that maybe would be best for you. They're asking about how the African Americans face more challenges, according to what we've presented, in terms of early fertility and single parenthood. So, how can this information be used, and what are the implications for the other groups that are not Hispanics that we have provided information for in our presentation? So how does this impact the programs that serve the non-Hispanic groups?
This is Cherise. In regards to non-Hispanic groups, I think that we are learning even more about serving them through research. But many of the things that we're seeing, that we've even heard here today, African American families specifically have challenges with employment issues. They have challenges around, financial stability. And so the programs really, the grantees really identify the target population they desire to serve, and they base really their program design and model based on what the needs of that particular population would be. But I would see there would be similarities in many cases to the services that the grantees provide, but there could be differences based on the needs, especially around absent fathers and perhaps child support issues and things of that type. But it's more tailored to the target population based on the community in which the program sits, as well as the needs that the families have. So I hope that answered the question, but I don't know that there are any additional implications of this research beyond just knowing more about low-income Hispanic families and seeing the similarities and the opportunities to serve families in a holistic way, no matter if they're African-American white families or Hispanic families, when it comes to things that they share that are common.
Cherise, if I could build on what you just said, I think you're absolutely right. I would add that these findings are relevant not only for African-American findings for some of the reasons you mentioned, but also within the Hispanic population, the variability that we talked about, and the notion, and I think both you and Rick also mentioned it, that we shouldn't be thinking about a one-size-fits-all when we think about programs, whether it's healthy marriage or responsible fatherhood, but we have to think about the complexity and the different dimensions of families, that whether it's Hispanic or African-American or others, that there's variability within these different populations.
Great. We've had several questions come in regarding eligibility and asking whether foreign-born parents are eligible for programs, whether there's a requirement that people be citizens. So I'm wondering if someone could address that in terms of the programs. Would that be Cherise?
Yes. In regards to the Healthy Marriage and Responsible Fatherhood programs, they are, first of all, they're voluntary. So individuals, families, or they are recruited to the program and they decide they want to participate. And then second, yes, all families are eligible to participate in these programs. They're not need-based, and so we find that we have families that are foreign-born as well as U.S.-born that participate in the program.
Thank you, Cherise. There's another question here with respect to Avance and whether Avance works with children, the older children also, and is there a requirement in participating with Avance to go through the 27 sessions, Rick?
Yes, we have, well, we also administer Early Head Start and Head Start. We always look at our parent-child education program as the pebble in the pond, if you will. But with all of our programs, to include our fatherhood program, we administer through a lens of two generations, regardless of the age group. But we incorporate with even Head Start and Early Head Start the parental engagement aspects of those programs, our core values and curriculum within the requirements of those grants. But when our parents are with us, they are all Avance parents, regardless of what program they may be in, whether it's a fatherhood program or whatever. You know, in addition, with our program, we do not ask person status. I mean, clearly with federal programs, you know, if the child is a U.S. citizen, then they are eligible, and families are eligible for different programs. But we do not ask, and if we're in a school-based setting, of course, you know, who's ever enrolled in our program receive our services. We do have a requirement of 70% attendance for the purposes of graduation from our parent-child education program. And just to close, for the National Research Center on Hispanic Children and Families, that this is so critical in the work that's being done, and I just tweeted for this particular conference that, you know, as Hispanic families go in this country, so goes the future of this country. And so I'm just pleased that these products are being produced, that it helps folks out in the field better serve the families in our community.
Thank you, Rick. And unfortunately, we're running out of time, or we have almost run out of time. So we couldn't get to many of the questions. I want to thank everyone on behalf of the National Research Center for participating and for their interest in the center. The webinar will be posted by early next week on the center's website. So for now, we just wanted to sign off. And until next time, look up. You can find us on the web, and also follow us on Twitter at NRC Hispanic, and on Facebook and LinkedIn. So good afternoon, and thank you all for participating.